The metabolic syndrome, or METIS, is a cluster of interconnected risk factors that significantly increase the chances of developing cardiovascular disease, type 2 diabetes, and other chronic conditions. It's a growing global health concern, fueled by urbanization, sedentary lifestyles, and dietary shifts. At its core, METIS revolves around insulin resistance, especially when accompanied by abdominal or waist obesity. Other key features are elevated blood pressure, high blood sugar, abnormal cholesterol or triglyceride levels, and systemic inflammation. What causes metabolic syndrome? The causes of metabolic syndrome are multifactorial. It involves a mix of some genetic predisposition and many lifestyle factors such as poor processed diet, physical inactivity, and weight gain, particularly around the abdomen. Visceral fat doesn't just sit quietly. It actively releases pro-inflammatory chemicals like TNF-alpha, leptin, and resistin, a hormone secreted by fat tissue linked to insulin resistance and the development of type 2 diabetes. These substances interfere with insulin signaling, making the body less responsive to insulin, a condition known as insulin resistance. Insulin resistance can arise from defective insulin receptors, abnormal signaling pathways, or simply an overwhelmed pancreas, a large gland behind the stomach which secretes digestive enzymes. Over time, this contributes to vascular and autonomic disorder, setting the stage for full-blown metabolic syndrome. Even early life factors matter. Evidence suggests that maternal health and nutrition during pregnancy and in early afterlife can influence a child's future risk of METIS. How is it diagnosed? Diagnosing metabolic syndrome involves a few straightforward measurements. Waist circumference. Central obesity is a primary marker. A waist circumference of 40 inches or more in men or 35 inches or more in women is a key diagnostic criterion. Blood pressure. A consistent reading of 130 over 85 millimeters of mercury or higher indicates hypertension. Fasting blood sugar. Levels between 100 and 125 milligrams per deciliter signal. Prediabetes, 126 milligrams per deciliter or more indicates diabetes. HDL cholesterol. Less than 40 milligrams per deciliter in men or 50 milligrams per deciliter in women is considered low. Triglycerides. A level above 150 milligrams per deciliter is a red flag. If someone has 3 or more of these risk factors, they likely meet the criteria for metabolic syndrome. Without intervention, metabolic syndrome can lead to serious complications, cardiovascular disease, including heart attacks, strokes, and heart failure, often before the obvious development of diabetes. Diabetes mellitus. Nearly all individuals with METIS eventually develop diabetes, which further worsens heart and vascular health. Obesity-related conditions, such as sleep apnea, pulmonary hypertension, kidney failure, eye disorders, recurrent infections, and osteoarthritis. Management and prevention of metabolic syndrome begin with lifestyle modification. The first line of treatment is to aim for a body mass index under 25 kilograms per meter square. Engage in at least 150 minutes of moderate physical activity per week. Adopt a diet rich in vegetables, fruits, legumes, whole grains, and lean proteins. Avoid refined sugars, saturated fats, and excessive sodium. Quit smoking and limit alcohol to under 10 standard drinks per week. Prioritize sleep and seek treatment for conditions like obstructive sleep apnea. Sleep health is more important than many realize. Sleep disorders disturb hormones and hunger control. Disorders like sleep apnea can both contribute to and result from metabolic syndrome. Fortunately, treatment can improve metabolic outcomes. Metabolic syndrome is preventable and often reversible. Recognizing the warning signs early allows for timely intervention through education, physical exams, appropriate tests, and medication where there is poor control of the disorders. By addressing the root causes, particularly lifestyle and insulin resistance, the personal burden of chronic disease is significantly reduced. Stay informed, stay proactive, and take small steps every day for a healthier future at Mini_Medical Lessons.